So it's not exactly known why some people get diverticular disease, but it seems to be linked to a few things. So in this video, we're going to be talking about, is fiber really needed? Does it prevent diverticular disease? So the exact cause of diverticular disease is actually unknown, but there are a few things to actually consider. So let's find out in this video together. It is linked to age, it's linked to diet, it's linked to lifestyle, and there's a link to genetics as well. But how far does fiber go in this story? Let's find out. So if you're new here, I'm a family medicine doctor, and on this channel we discuss medical topics and lifestyle. Please like and subscribe for more videos like this. It goes a long way. Please check our other videos on the topic of diverticular disease and diverticulitis, where we dive into the management of things, the specific diets to eat for this as well. Please check those videos out. But in this video, we're going to be focusing on, does fiber prevent diverticular disease, and what is its role to play in this entire story? So briefly, let's go over what diverticular disease actually is. So diverticulae are outpouchings in your colon. Think of it a little bit like a hernia. It's a similar kind of principle. The innermost part of the wall of the intestine pushes through and forms a pouch. Diverticular disease means you have these small growths or pouches. Diverticulosis is just another word for diverticular disease. And diverticulitis is actually when there's inflammation of these pouches, of these diverticulae, and they can then cause a lot of trouble. And what I mean by that trouble is they can cause symptoms such as abdominal cramping, pain, tenderness in the area, swelling, bloating, constipation, and diarrhea. So this is called diverticulitis, and it's mainly in that left lower quadrant. When you speak to your doctor, when there's a flare, you might get some antibiotics, you might be advised to rest, and you might be advised a certain diet if you're lucky. Like I said, we cover these things in other videos. But that's the brief overview of what is diverticulitis and what is diverticular disease. So when you have these pouches that are inflamed, what you actually want to do is reduce the traffic in the gastrointestinal tract to prevent further irritation. We have other videos on that as well. But here the question is, does adequate fiber in the diet actually prevent these diverticulae from forming? In other words, can we prevent the pouches from ever occurring as a whole? So we mentioned some correlation at the start of the video, what it might be linked to. Let's dive into those risk factors a little bit more. So with age, we know that the walls of the large intestine, they become weaker, and the pressure of hard stools passing through your intestines cause these diverticulae to form. In fact, majority of people will get them at some stage in their old age. So age plays a role. With genetics, there is known information. If you're more likely to develop diverticular if you have a closer relative with diverticular disease, especially if they are younger. Then we come to the lifestyle side of things. This is the bracket that's very interesting. So there are certain things at play that have shown to increase the likelihood of diverticular disease forming. You have a lack of movement, so that's important. You have smoking. You have being overweight or obese. You also have a history of constipation, as well as long-term regular use of painkillers such as ibuprofen or aspirin. So these are the lifestyle components, risk factors in the formation of diverticular disease. A lot of them make their own case in contributing, but they compound in a manner that ultimately results in a diverticulae forming. When you have a lack of fiber, this compounds even further. It makes the stool harder, makes the stool firmer, the pressure rise, and it affects the muscle tone in the intestinal wall. This then results in diverticulae forming. The way fiber helps in this is not only by making the gut healthier in terms of the microbiome and your immunity, but it also makes the stools softer and less pressure, so the walls of the intestines don't feel that burden as much. And the opposite of that is when the pressure rises, the stools are harder and the traffic in the gut slows down. So instead of things flowing smoothly, they get clogged up. So how much traffic is normal and how much is not normal? Well, here we start to talk about the colon transit time. So how often we are opening our bowels. So one of the most common health problems in modern civilization is chronic constipation. Studies of other cultures have consistently shown the correlation between healthy colons, larger stools, and colon transit time. If If you look at African and Asian natives from rural communities who eat bulky, high-fiber diets with little or no meat and no refined foods, they're almost completely free of chronic diseases. When we're talking about hunter-gatherers, for example, their stools are so much bigger than the city dwellers, and how much stool they're actually passing. The amount of fiber that they are consuming is much, much more compared to their city dweller counterpart. And this isn't just random people. These are studies of populations from hunter-gatherers and the same genetic pool of people who live in the urban setting. So there's a vast difference there in the fiber content and the colon transit time. And what it ultimately results in is a decreased reduction of these chronic diseases. So can we call these chronic diseases Western diseases? Well, that's a good question, isn't it? So what is actually colon transit time? So it's the time it takes to evacuate your bowels after eating something. So we can determine this, for example, if you eat some corn or some beets. And then we see how long it takes before you actually see it in the stool. So that's a nice, easy way of seeing the colon transit time. If the colon transit time is found to be too rapid, then that may indicate poor absorption of nutrients. If it's too slow, then that's also suboptimal colon health. So it has to be at a good range. And there's a big difference between the city dwellers and the hunter-gatherers. So does a lack of fiber contribute to diverticular disease? Absolutely. Is it the absolute sole cause of it? No, it's not. But we have unavoidable factors and we have absolutely avoidable factors. And fiber is most certainly one of them. So nothing is preventing us from eating a healthy, balanced diet. Nothing is preventing us from adding the food sources of fiber into our diet. There really is no excuse for not having enough fiber in our diets. Nothing stops us from adding a tablespoon of flaxseed, for example, into our porridge or into our meals throughout the day, into our smoothies and things like that. So we need a good amount of fiber in our diets to prevent chronic diseases from happening. It's not the only cause, but it most certainly is one of the biggest avoidable risk factors that are completely in our control. In the same way that exercise is and smoking is, having a good amount of fiber goes a long way in preventing diverticular disease. And it most certainly, a lack of fiber contributes to diverticular disease. Thanks for watching the video. Like and subscribe. Please leave a comment of your thoughts in the comments below, and we'll see you in the next video. Take care.